Hello, everybody. This is Andrew Cosman, physiotherapist with ADM Ottawa Physiotherapy. Today, I wanted to share this video with you on the subject of long COVID. So many of you might have heard this term related to the COVID-19 virus, and many of you may not have heard of the term long COVID. But as the name suggests, it's a term that's been developed to describe the persistent symptoms that a person might be experiencing beyond the normal recovery time. So just to give you a little bit of statistics on the subject, as we all know, people typically had this 2-week, 14-day type known recovery period. But for symptoms that persist beyond that, it was not uncommon where we saw statistics suggesting about 13% of people having symptoms for longer than a month after infection, and then about 2.5% of people having symptoms even up to 3 months after the initial infection. And for those who were bad enough to have been hospitalized, we see about 30% of those people up to 6 months after infection experiencing symptoms. And now what's interesting a little bit about these symptoms is just the number of systems in the body that can be affected by those symptoms. So we know well that some of the initial impacts could affect a person's sense of smell, for example. And then we know also well that it could affect a person's level of energy and their fatigue. So there are upwards of 10 different systems in the body that could be affected by long COVID. And we want to talk a little bit about the particular implications when it comes to exercise and physiotherapy. We named one of the better known symptoms, that of fatigue, and the need to be really mindful of a person's limits after they've experienced COVID. Now, if you're like me, it was not uncommon before December to know only 1 or 2 people who may have had the COVID-19 virus, but with the more contagious variants that have been coming out, it seems almost everybody has had it that I know. So I'm sure if you're in the similar boat, that you know many people who have experienced it, even if they have been vaccinated. So the video and the content and the discussion about fatigue is still very relevant for people. Especially if we know anybody who's been bad enough to be hospitalized. Now, why is this more important? Because a lot of people, as a personality type, might have a tendency to go, and even traditional physiotherapy tends to want to push a person and their limits, not necessarily with a no pain no gain mentality, but it's not uncommon to hear this terminology used from both patients and therapists alike. So with long COVID, when fatigue is a factor, we really do have to respect a person's boundaries more so than before. So in that case, there's been a treatment suggested that talks about stopping, resting, and pacing. That's really the approach that a person wants to take if fatigue has been a persistent problem after they've been infected with COVID. You want to really respect your boundaries when it comes to your exercise tolerance and stop, and then you're going to rest until you recover sufficiently, and then you want to re-engage in activity eventually by pacing yourself into a normal or steady return to activity. It's not uncommon for somebody who does struggle with fatigue, especially after COVID, to find very simple tasks like taking a shower or maybe even brushing your hair to be something that puts somebody into a very long recovery period. And this sounds extreme for many people, but it's not completely uncommon either. So we do want to be vigilant. We want to share this information with people who do have excessive fatigue after having struggled with COVID, and especially if they are of either a go mentality or have particular interest in physical activity, that they do really need to respect their boundaries and remember the stop, rest, and pace sequence in order to re-engage into exercise within a person's individual tolerance. As always, if you have questions, you could always reach out at 613-820-8765, and I'll be happy to answer your questions. Until next time, take care.